you are in the know. It's been just about 5 months since President Joe Biden left office, but yesterday, a bombshell coming on social media. The former president battling an aggressive form of prostate cancer. It is spread. It is metastasized. The former president tweeting this morning saying, quote, "Cancer touches us all like you, so many of you. Jill and I have learned that we are strongest in the broken places. Thank you for lifting us up with love and support." That message was accompanied by a picture of him sitting alongside his wife and, of course, their family cat. Joining us now is Dr. Steve Goldberg to break this down a little further. How dire is this diagnosis for the president?
It's a serious diagnosis for the former president. The good news is he's got excellent care, and we have had evolution in treatment over the past few years. So we're all very optimistic for him.
Prostate cancer seems to be, at least once diagnosed, to tell the level. It's not just your typical cancer levels, if you will, but also based on the Gleason score. What do we know? Because he did share that on that Gleason score, he has a score of a 9. What does that mean?
That is a high Gleason score, which is unfortunate. It reflects the tumor type, and also the president has disease beyond the prostate. So he's going to be needing aggressive therapy. The good news is, again, he's got excellent care. The message, I think, for all men in the United States is to be aware of guidelines and seek out a conversation with your own clinician on what type of surveillance you should do.
Yeah.
As soon as the president had any abnormal symptoms, he was seen by a doc, an abnormal finding was made, and he was evaluated and is getting into right care.
And I think to that point, Dr. Goldberg, I know now it's easier to test for prostate cancer based on blood work. You can see the levels there on the PSA score, et cetera. But then also on the guidance, you read some of the guidance, and it almost says that if you're over the age of 70, which we know the president is, the former president, then there should only be testing of some sort. It shouldn't be the typical diagnostic for this. A little bit over the place, maybe, for some that are just seeing this from the outside. What do we know about the guidance for men? And really, when should you talk to a doctor?
You're calling out important observations. When we think about it, there are 3 key bodies that give us guidance: the U.S. Preventative Task Force, the American Urologic Association, and the American Cancer Society. And in general, for men 55 to 69, according to the USPSTF, they should have a conversation with their doc and talk about what type of screening should be done. In general, once you're over 70, the risks and benefits don't warrant routine testing. So that's why the president evidently just had some abnormal symptoms presented, but got rapid engagement in his symptoms.
Yeah, I know a lot has been unfortunately talked about amongst people that are not doctors about how this is so advanced. But to your point, the guidance does not say to get tested once you're past the age of 70. And we know at this point closer to 80 than anything. So there we have it, an advanced state of this prostate cancer. And again, it's hormonal, right? So it can be treated in maybe a more effective way, if you will.
That's exactly right. His physicians reported that this tumor is hormone sensitive. There's good evidence that that type of treatment will be helpful. There's also some strategies to manage the disease that's beyond the prostate. So again, he's getting great care, and we wish for him best outcome.
Dr. Goldberg, thank you so much for your insight on this.
My pleasure.